found that pain disorder was like 12%. Pain disorder where you have such kind of pain that is caused by a psychological factor. There is one that is only psychological factor, and one that the patient that have maybe some physical, general medical condition, but the psychological factor make this pain more and more. The pain association with general medical condition was the 7% of patient, and with psychological factor was 5%. That means that this patient has is also documented by quite several studies, a high degree of somatization. They present a lot of symptoms, a lot of pain. Like mostly, as you can say, gastric pain, 36% of patients with pain, headache, 33%, and back pain. And they present pain for a long time, mostly like 29 months, more or less 2-3 years. And the same, and the depression is a bit low, like 18 months. Just seems that the patient before start to somatize, to express with the body some psychological distress, and then became depressed. Then we found that general anxiety disorder was like the 9% of patients. General anxiety disorder are people that are most of the time anxious about several things, wasi-wasi. They don't sleep, they have some problem, they are restless. Social phobia, people that have a fear to stay with other people or to do things in public, 5.7%. Alcohol dependence, 5.7%. Obsessive compulsive disorder, 5.3%. This is a serious disorder, it's an anxiety disorder, patients that have social phobia, people that have a fear to stay with other people or to do things in public, 5.7%. Alcohol dependence, 5.7%. Obsessive compulsive disorder, 5.3%. This is a serious disorder, it's an anxiety disorder, patients that have, like, for example, the most common obsession that we saw. Possession is a thinking that, images or an impulses that is intrusive, distressing, come to your mind and you can, you have to think about. For example, the most common was the fear of harming someone or embedding images. And these images make you anxious and you have to do something to put out this anxiety. We say compulsion. For example, some rituals, or like we have seen washing and counting. And this is a serious disorder. People take more than 1 hour per day doing this, such as things. And this 5%. Then post-traumatic stress disorder, 5%. Post-traumatic stress disorder is also a serious disorder, like people that had a trauma. We saw like see someone dying, an accident, physical assault, a big trauma, and maybe they cannot sleep, they are restless, they dream or they have flashback about this trauma, they can't forget, they can move forward, and they avoid everything that remind them this trauma, and often are depressed. And then also we found common like panic disorder. Panic disorder, 4%. Person that have sometimes when there is no reason, some attack of anxiety start to trembling, shaking, like a lump in the throat, the palpitation, things like that. They are feared to die and losing control. And we found that it's like 4%, and 4%. Then dysthymia, that is a kind of depression that is low, but it takes longer time, like for at least 2 years. The patient with dysthymia were 3.7%. Alcohol abuse, the alcohol abuse difference between dependencies that is most severe. People do a lot of bad things, they cannot stop drinking. It was like 3.7%. Hypochondriasis, people that fear too much to have a serious physical illness, like HIV, like malaria, like TB. They go to the doctor say no, do the exam, no, you are okay, no problem, but they still fear a lot, and this interfere with their daily life. And then with a few patients with psychotic symptoms, like 1 to 3% of patients that have psychotic symptom current. Psychotic symptom may like schizophrenia, patients that have some hallucination, some delusion, and drug abuse, drug dependence, at least 1%, few patients, and we found, this is a result that we didn't expect. We found 3 patients with bulimia nervosa. That is a disease with cultural bound that typical in Western society. There are some women that have problem with it. They eat too much, but then they feel like guilty, and they did something to expect, like they vomit or they take laxative to wash themselves from this food. You know? They have a difficult relationship with food and also with the images, physical imaging. And we found the 3 patients, and 1% have this kind of disorder. Then drug abuse, 0.7%, mood disorder with psychiatric feature. That means you have both like schizophrenia, delusion, hallucination, and a mood disorder. 2 patients, 0.7%, and somatization disorder. This is like some patients that have quite a lot of symptoms. They say I have pain here, diarrhea, vomit, a lot of things from childhood, and 1 patient, the 0.3%. And then the patient with panic disorder lifetime and was like 13%, and the patient with social antisocial personality disorder, more or less 6%. And psychotic disorder lifetime also like 2%. Then we analyze these the social demographic characteristics difference between mental disorder. So we go and see if the patient that has at least 1 psychiatric disorder, so the 52% of the sample, if there was some different. For example, we saw that from sex there were no statistically significant difference. The 57% of female have a psychiatric disorder.